critical need, with potential solutions pitched from the local, state, and federal level.
Vermont Roundtable data shows there are over 8,000 RN job positions open in Vermont right now. One potential solution being used at hospitals across New England is training current hospital employees to become nurses. At Northwestern Medical Center in St. Albans, more patients are coming in the door, but there's less nurses on the floor.
I feel like post-COVID we're more challenged.
Director of Professional Development Kelly Campbell says daily census of patients have gone from 18 to 34 in recent years. They've added beds, but she says the hospital is having a hard time keeping up.
Patients wait longer to access care than they used to, so when they do, they're sicker or their condition is more acute. So I think there's a lot of things that play into that.
The hospital had up to 70 nursing vacancies, but that number has now dropped to 36. Chief Nursing Executive Don Craigle notes dozens of those filled positions are traveling nurses who typically get paid more than full-time staff. Through a new employee to nurse pipeline program, she hopes to rely less on travelers in the future.
Hi and Assalamualaikum. My name is Nur Najiham Tibisri. My matric number is 2023-226308 and I am currently in semester 3 studying Bachelor of Business in Human Resource Management. I am truly honored to have my respective lecturer, Madam Zarina Binti Abdul Munir, as my audience. Right now, I will present about the latest issue that arises related to talent acquisition, which is talent shortage in Malaysia. We will go with the introduction first. So basically, the healthcare industry faces growing pressure to meet the demand for skilled nurses driven by an aging population, rising healthcare needs, and rapid medical advances. Despite this demand, recruiting and retaining qualified nurses is increasingly difficult due to long shift, heavy patient loads, and challenging working conditions, leading to high burnout and turnover rates. A National Academy of Medicine study found that over 50% of nurses experience burnout, contributing to voluntary resignation. High turnover impacts care quality and costs organization around $30,000 until $60,000 per nurse loss. In response, they developed a strategy to reduce vacancies, lower turnover, and improve job satisfaction and care quality. There are several issues that I found in the article. The first issue is nursing shortage and difficulty in attracting qualified nurses. The neurology department faces a pressing need to fill nursing vacancies, and attracting qualified nurses is a challenge. This shortage not only impacts patient care but also increases the workload for current staff, making recruitment an urgent priority. The group's focus on recruitment aims to reduce these vacancies and address the underlying difficulties in attracting nurses to the department. The second issue is creating a comprehensive vision for recruitment. Establishing a clear department-wide vision for recruitment was crucial to guide the group's effort. This vision aimed to make the neurology department more attractive to potential hires by emphasizing its commitment to creating a supportive, growth-oriented work environment. This vision setting provided a strategic direction for recruitment initiative that aligned with the department's long-term goals. The third issue is incorporating professional development and flexible scheduling. The group identified professional growth opportunities and flexible scheduling as critical factors in attracting new nurses. Offering career development path and work flexibility addresses key motivation for job seekers and distinguishes the department as a competitive choice. Flexible schedules also appeal to nurses seeking work-life balance, especially in high-demand specialties. The final issue is need for competitive compensation and active engagement. Competitive salaries and workplace culture that encourage nurses' involvement in decision-making were highlighted as essential recruitment tools. The team recognized that many prospective nurses look for both fair compensation and a collaborative work culture which can enhance job satisfaction and commitment. Active engagement in decision-making empowers nurses, creating a sense of ownership and belonging that makes the department more attractive to potential recruits. Next, I will talk about a few factors that cause to these issues. Firstly, high turnover and job satisfaction issues. High turnover and challenges in job satisfaction suggest that many nurses leave due to factors like burnout, workload, or lack of support. This creates a continuous cycle of staffing shortage where the retention of existing nurses is as critical as recruiting new ones. Enhancing job satisfaction is essential to reduce turnover, which is why retention strategy were given early focus. Next factor is importance of supportive work environment and growth opportunities. Supportive work environments and professional development opportunities were identified as essential for retaining nurses. This highlights that job satisfaction among nurses is often linked to work condition, opportunities for advancement, and access to resources that reduce workload and support professional growth. Without these elements, nurses are at greater risk of burnout, affecting both retention and patient care quality. Furthermore, need for flexible scheduling also one of the factors contributing to these issues. Flexible scheduling is increasingly important for recruitment and retention as it supports work-life balance for nurses. Rigid schedules are often a source of dissatisfaction and turnover, so offering flexibility can make the department more attractive to new recruits and help retain current staff. Last factor is need for talent recruitment and retention strategies. The difficulty in both recruiting and retaining nurses has created a need for specific targeted strategies that can effectively address the neurology department staffing requirements. This dual approach recognizes that recruitment alone won't suffice if retention issues aren't addressed. A stable workforce is only possible through combined efforts to attract and retain nursing talent. There are several recommendations to overcome these nursing shortage issues. Firstly, strengthen flexible scheduling and work-life balance initiatives. Incorporate flexible work schedules to help nurses manage personal and professional demands. Adjusting shift lengths, allowing for more frequent breaks, or providing options for part-time work can reduce burnout and improve job satisfaction. Secondly is promote mental health support and burnout prevention. Offer access to counseling, stress management workshop, and burnout prevention programs to help nurses cope with the demands of the job. Create a supportive work environment that prioritizes mental health. Thirdly is increase engagement in decision making. Encourage nurse involvement in decision-making process, especially in policies affecting their work environment and patient care practices. They will feeling valued and can lead to the greater job satisfaction. Next is regularly evaluate compensation and benefits packages. Conduct market analysis to ensure competitive salaries and benefits that align with the industry standards. Fair and transparent compensation models are essential for retention and attracting new staff. Last but not least is adopt technology solution to reduce administrative burdens. Reduce administrative tasks through technology, freeing nurses to focus more on patient care, which can enhance job satisfaction and efficiency. Last but not least, I will talk about several implications found in these issues. One of them is enhanced workforce stability. The reduction in nurse turnover from 22.6% to 20% reflect an improvement in workforce stability, which is critical in healthcare settings where continuity of care affects patient outcomes. Lower turnover rates also reduce recruitment and training costs, providing financial benefits for healthcare organizations. Other than that is increased job satisfaction. The rise in job satisfaction scores suggest that the implemented strategies are successfully enhancing the work environment. Higher satisfaction is often linked to increased engagement and productivity, meaning that nurses are likely more committed, attentive, and less prone to burnout. This translates to improved morale and job loyalty, which further reduce turnover. Furthermore, improved patient care quality. The increase in quality of care scores from 82.2 to 89.2 indicates that the interventions are positively influencing patient assessment and care outcomes. Enhanced job satisfaction among nurses is linked to the higher quality, more compassionate care, ultimately improving patient satisfaction and health outcomes. This quality improvement trend underscores the impact of the stable, motivated workforce on care standards. Besides that, financial efficiency and operational resilience also one of the implications found in this issue. Strategic planning has proven effective in reducing turnover and improving operational efficiency, which has a lasting financial impact. By minimizing recruitment costs and stabilizing workforce availability, healthcare organizations can reinvest resources into other essential areas. Furthermore, a stable, satisfied workforce fosters resilience, allowing organizations to better manage challenges such as surge in patient demand or economic shifts. Lastly, creation of a practical model for broader application. The framework developed in this quality improvement project can serve as a reference for other healthcare organizations facing similar recruitment and retention challenges. Its evidence-based, practical approach offers actionable steps that can be adapted to various settings, potentially benefiting the wider healthcare industry. In conclusion, the growing demand for skilled nurses highlights the urgent need for effective recruitment and retention strategies. High turnover, driven by burnout and challenging work conditions, impact patient care, cost, and staff morale. Their strategies are to focus on job satisfaction, flexible scheduling, development opportunities, mental health support, showed positive results with lower turnover and also better care quality. These improvements underscore the value of a structured, evidence-based approach to managing nurse shortage. This project provides a model that can be applied across healthcare settings. Ongoing research on vacancy rates, stress, and workforce compensation will help refine these strategies, ultimately strengthening patient care and creating a more resilient, supportive environment for nurses.